on our faces. Bright and early.
I don't feel good at all, Sprocket. I need to go see Dr. Yerple. In Winston-Salem, born and raised. Med school is where I spent most of my days. I like to take a minute, just sit right there. I tell you how these nonsteroidal anti-inflammatory drugs work in there. Hi.
Hi, are you here to see Dr. Yerkel today?
Yeah, I think so.
What's your name?
Jasmine.
Okay.
Romero. Something.
I just need you to sign this and check that for me.
Okay. Oh wait, check.
She'll be right with you, but before you go back, may I ask what's going on?
I've been having a lot of a really high fever. My head is hurting a lot.
Nope. Okay. Well, I will definitely go back and get her right now.
Thank you.
Hey Jasmine, how are you doing today?
I could be better.
Alright, well I'm Dr. Yerkel and I'll be taking care of you today. Alright, so what's going on?
I've been having a really high fever. My head is always pounding. I've been trying to drink tea, but I haven't really drank any certain medicine because I don't trust medicine like that, so.
That's wise. Alright. Well, have you been coughing? Like, are you fatigued?
Yeah, I've been coughing. I'm always sleepy. It could be exams, but at the same time,
Right,
I'm still sleepy.
I know when you're under a lot of stress, your immune system's more vulnerable, so you probably have a little bit of cold.
Okay.
Have you been going to the bathroom regularly? Have any stomach problems?
No, not at all.
Okay.
I've been going regularly, yes.
Alright, good. Well, are you allergic to any medications?
No.
No? Alright, well sounds good. I'm going to prescribe you an NSAID, which is like ibuprofen, and I want you to make sure that you eat when you take it,
Okay.
and you get a lot of sleep, and try to stay away from alcohol.
Okay.
I know, it's 21-year-old, but you gotta stay away from alcohol.
Okay.
Alright, well I'll write up this prescription, and I'll give it to you. The nurse will be right in.
Okay, thank
Alright,
you.
thanks, I'll be right back.
Freak is an NSAID. Wait, Dr. What's an NSAID?
I'm glad you asked. I'll tell you.
Okay.
I'm so glad you asked what NSAIDs are. They are non-steroidal anti-inflammatory drugs.
Oh.
And they're primarily used to treat mild fever, pain, and inflammation of your cells.
Okay. What is inflammation?
That's a good question. Inflammation is a biological response of your vascular tissue to a harmful stimuli. So basically, it's a response of cell damage.
Oh, okay. So how does this help me particularly?
Good question. Okay. So obviously, your body has cells. In every cell in your body, you're going to have a phospholipid bilayer, and that's the membrane around your cells.
Okay.
And in that, you'll have a phosphate head and a fatty acid tail. On your fatty acid tail, you're going to have a 12-carbon regulatory molecule called arachidonic acid.
Regulatory molecules are...
Good question. Regulatory molecules are molecules synthesized by almost every tissue in your body.
Every tissue?
Almost every
Oh,
tissue.
okay.
And what they do is they have actions that are linked to defense against pathogens, which are things that can cause diseases, and inflammation, like what's going on with you.
Oh, I have inflammation?
In your head, if you're a headache. So Jasmine, it's basically like a chain reaction. When cells are damaged, they release arachidonic acid. Arachidonic acid is a catalyst for the COX enzyme, and the product of this reaction will bring us to prostaglandins and thromboxanes.
Pasta what?
Prostaglandins and thromboxanes. These are regulatory molecules just like arachidonic acid.
Oh, okay.
And the formation of these regulatory molecules begins with a stimulus in the cell that activates a membrane enzyme called phospholipase A2. The stimulus is something that might be a condition that causes or threatens to cause tissue damage.
Okay.
So prostaglandins are essential in the healing process. So when you get a cut, when you're sick, your body is trying to fight back to heal you. And the list here, inflammation, pain, fever, I know they sound bad, but it's how your body is healing yourself. So this fever that you have is really good for your body. I know it doesn't feel good. But what they do is they trigger inflammation, pain, fever. They also maintain the integrity of the gastrointestinal tract, which is why if people take too many or if they don't eat with anything, they could get stomach ulcers. And it increased platelet coagulation because you want to scab and you want to heal that area. So when you get cut on your elbow or on your knee, you have a scab because of the platelet coagulation.
And no bacteria gets in.
And you're right, exactly. So basically, to answer your question, NSAIDs will influence this entire chemical reaction that's happening inside your body where the tissues are damaged to inhibit prostaglandin production.
So do I want the fever? Do I not? Do I want inflammation? Do I not?
Well, at first you do want the fever because the fever is what's healing you. And so, but if the fever lasts too long or if it gets too high, that's when you should consult your doctor.
Oh, okay. Thanks, Dr. Yerpel.
If you are taking NSAIDs, you may experience gastrointestinal problems like ulcers and other problems in your esophagus, stomach, or small intestine, high blood pressure, and kidney damage. If you have asthma, make sure to consult with your doctor before taking NSAIDs. You may experience blood thinning and anti-clotting properties.
This headache's gone. Thanks, Dr. Yerpel. Ow.
You're welcome. All right, Jasmine. Well, I'm really glad you asked what NSAIDs are. They are nonsteroidal anti-inflammatory drugs, and that's just the word we use. So, what they do is they're primarily used to treat inflammation of your cells as well as mild to moderate fever and temperature. Fever. Wait. Well, Jasmine, I am so glad you asked what NSAIDs are, and I'll tell you now. That's so cheesy. Can you list for the reaction of COX? COX is an enzyme which then leads to a product of prostaglandins. I said prostaglandins. I can't say prostaglandins. It's the wrong word.
That's all, folks.
Animals or humans were harmed in the making of this video, except Sarah. Sarah had a headache, for which we gave her an NSAID.